Hello everyone, this is Dr. Sushmita. Today I have come up with another interesting chemical which is a hemostatic gel and liquid by Waldent. So let's discuss all about this product. Waldent Hemostatic Gel and Liquid is composed of 25% buffered aluminium chloride, purified water, glycerin and excipients. The aluminium chloride present in Waldent Hemostatic Gel and Liquid is an astringent, which when reacts with the blood protein creates a mechanical barrier by coagulated proteins and prevents the outflow of blood from the vessels. It comes in both gel and liquid form. It is designed to be used with gingival retraction cord to control bleeding and also as a lubricant to facilitate the insertion of cord into the sulcus. It does not stain the hard and soft tissues, which is especially critical in the aesthetic zone. It does not present any cardiovascular problems as it does not contain epinephrine. It can be rinsed off easily. It can be used to control bleeding during gingival sulcus retraction prior to impression making. It is used for controlling gingival bleeding and oozing prior to procedures like crown preparation, prosthetic restoration such as crowns, veneers, bridges, inlays, and before placement of metal bands and cervical matrices. It also inhibits bleeding while removing a small fragment of the marginal gingiva or an overgrown gingival papilla. Attach the applicating tip to the hemostatic gel tube and check for a smooth flow of material. Now apply hemostatic gel directly to the bleeding area. Take a cotton-tipped applicator, rub and apply pressure to the bleeding area. Keep rubbing and applying pressure for 2 minutes. If hemostasis is not achieved, repeat application, wait for 2 minutes, rinse with water and air dry it until bleeding stops. When using hemostatic liquid for impression making, take a required length of gingival retraction cord and place it into the dampened dish. Now pour the adequate amount of hemostatic liquid into the dampened dish and drench the gingival retraction cord completely. The excess hemostatic liquid should be blotted on a cotton tissue before placement. Then place the damp retraction cord inside the prepared tooth's gingiva to control the gingival bleeding prior to impression making. Thanks for watching, and if you like the video then like, share and subscribe to our channel.